Welcome back to Health Bites from our specialists. I'm Genevieve, and today I have with me Dr. Cynthia from the Department of Radiology here at Sengkang General Hospital.
Hello, everyone.
Medical technologies are amazing these days. They help us to detect health problems early and keep people safe. One big part of that is due to radiology. Now, there are so many processes and machines involved. I'm wondering what sets them apart.
Yeah, that's a great question. We have a huge array of diagnostics, and the thing that sets them apart is radiation. So some of the equipment will have lots of radiation, such as CT scans, maybe X-rays and mammograms. And then there's another cohort that does not offer radiation, such as MRI or ultrasound imaging. They're free of radiation. MRI is very good to image brain and spinal cord pathologies, whereas CTs is really good for emergency. For example, a patient with trauma coming to the A&E or a patient with abdominal pain in A&E. We use CT because it's faster, it's cost effective, and despite the radiation, gives us really accurate information.
So speaking of radiation, I'm sure that's something a lot of patients worry about, right?
Yeah, that's true. I would worry about it for my family. We definitely want as little as possible. And we follow the ALARA principle here in radiology, where we want to answer the clinical question with as little radiation to the patient as possible.
Now, let's play a little game called Myth or Fact. Now, here I'm going to pick some statements from this box, and we will both decide if it is a fact or a myth.
Sure.
Let's get into it. Fact?
Yeah, it is a fact. It is dangerous for your health, just as dangerous as eating 200 bananas in one sitting. Yeah.
No way.
Yep, you got that right. Just like radiation all around us that comes from machines, from the sun rays, especially when you're taking a long flight, they all have radiation. But do we stop doing them? Not really. We just do them sensibly. It's a myth.
Ooh, okay.
And I want to be grateful for that. X-rays actually cause or carry very little radiation. That's about 0.1 millisieverts in X-ray terminology. And it's like if you did a CT brain, that's about 100 to 200 X-ray equivalent. And even if you had many CT brains throughout your whole lifetime, it would not carry enough radiation to give you cancer.
Yes?
You got that right, Genevieve. Yeah, babies, children, they're little humans. Their bones, soft tissues, bodies are still developing. They won't be able to handle radiation the way you and I can. And so for that reason, we tweak it down further for them. We fine tune it so that it offers as little as problems related to radiation, which in everybody's mind is cancer. So yes, we are very safe. In fact, for children, we do more ultrasounds, MR imaging, and CTs are best left for really, really big emergencies.
Well, that's it for our little game. Thank you for sharing so many incredible tips with us and fun facts about radiology. And thank you very much for spending your time with us, Dr. Cynthia.
Yeah, you're welcome.
Now that we know what's true about radiology scans and what's not, we hope that you now have the confidence to take charge of your healthcare journey. Thank you for joining us, and we hope to share more tips with you on Health Bites from our specialists. Until next time, bye!
Bye-bye.